Welcome to the show. Thank you for coming on. I appreciate it.
Thank you, Dr. Gruner. Nice to be on.
So I think I've been seeing you for about a decade or so. So if you could share with us some of your history, like what brought you to see me, and then kind of walk us forward.
Of course. So someone introduced me to you, how you helped her from her depression and anxiety, and I was working as a pharmacy technician, and I had a lot of anxiety, and I just didn't know what was going on, and then she recommended you, and ever since I've seen you, you have helped me so much, with all my mood stabilizers. So when I come and visit you, you talk to me for the first hour and get to know me, and then we start from there. And you just, we play with the meds, and we talk about it. If we don't like it, then, you're always on top of it. You always help me and people that are depressed too. And every since I've been with you, I've been better. And I haven't had any anxiety, any depression, really. I just literally am really mellow. And if anything changes, you always fix it.
Yeah, I like to tweak. I call tweaking and playing with things, and we have to, when I get to know someone for a first time, I usually spend about an hour, but I like to get all the history, all the details, and then and there's a lot of interaction between me and there's a lot of phone calls in between visits to try to tweak the dosing and try to get things just so, because everyone's an individual, and I have to try to figure out exactly what's right for each person, which you can't always tell at the beginning. It's a lot of trial and error. I call it rational trial and error, but it's still trial and error because we don't know until we try it, see what the response is, either lower it.
Yeah, and when I came to Dr. Corona, you helped me so much because I was so scared to take all those mood stabilizers. I remember coming in, I was I just have anxiety. I didn't know if I had depression, and you didn't make me feel like taking meds is a bad thing. And you explained it so well, the connections through your brain, that made me want to try it out. And I've never been on meds before. And I've noticed such a difference, in anything that we tried. And when I talked to you about, whatever we do with our doses, you always gave me the directions on how to take them. If you're feeling good, if you're not feeling too good, then we stop there. We just play with them. And I've played around with a lot of meds. And, I just feel you've helped me a lot for the last 12 years, even honestly. For me.
Yeah. And then a month ago or so, I was pretty concerned about you because you weren't doing so well. Tell us what happened.
So I've been going through a lot. I stopped taking my meds because I kind of wanted to see what was, really making me feel. And sometimes it's not always the meds that make you feel like that. It's stress. It's your life, and everybody's different. I feel and you taught me that it's genetic. It's not a bad thing to have to be on medication. And you explained that really well to me. But I cried to you on the phone. I just so helpless on these last few months. And you really turned it around to where I wasn't feeling that way at all. So every time I reach out to you, you're just always on top of how I feel, what's going on with me, check on me, and you have me try these different things. And then if I call you and ask you that it's working, you're so fast at sending it to the pharmacy and getting everything done. And I've just been happy that you're my psychiatrist.
And I think you were having some work issues too, and then some financial stress. So you were going through. I was really concerned about you because you were.
Honestly, was crying my heart out.
You were
so emotional. I was so down and out. I didn't even want to
Right. I know you told me that. Yeah.
Yeah, but I don't know. I was just so down and out, and you knew what to do. You knew that. We just started over, I remember being here in a different area. My emotions were different every other year or something in my life happened. And you always explained to me what's going on I'll let you know. And then you literally like, know your work and you explain it to me and try to see if this will work. We'll start here, we'll move up. And then if that's not working, then we'll, like everything. You've always been there for me. And I honestly was such in a bad spot that I didn't even want to live anymore. And I know that.
I know.
But I honestly was so sad. And it really helped me a lot. So that's why I come to you, because you've been a really good doctor. You're amazing, and I send a lot of patience to you.
I know you do. Thank you.
Because a lot of people are not happy these days, and it's really hard to struggle. Yeah. And you've been one of the best people as a pharmacy technician from all the other doctors. You're always on time. You always right away send things in. You don't ever you're just on top of it. You've always been your own practice, and seeing how you treated me, I have been a better person because of it.
It's interesting. Yeah. It's interesting, and I mean, I know you being a pharmacy technician, you deal with a lot of offices, yeah. And it's just amazing to me when I hear people saying that, oh, I never hear back. I left a message, and I mean, from the very beginning of my practice, over 30 years ago now, I mean, I've always returned every phone call same day, every email, every pharmacy call, I don't go home until everything is done. And I just don't understand. I return every message. So when someone calls me, I call them back. And I just don't understand. A lot of doctors just don't do that. And then especially in the field of psychiatry, it's so necessary because we have people that are suicidal that, you have to be on top of things. And if you're not, then it can lead to disaster. And in your case, I think I put you back on the Pristiq Wellbutrin. I think I lowered the dose of Pristiq, and then I put it on, I added Lamictal, was the last edition. I think that really helped to stabilize things, right?
Yeah. Okay. So I took so we've tried a lot of things, and I've been on multiple things for different situations in my life. Mm-hmm. And this last time, I don't want to tell you that I'm suicidal, or I feel that way. But, it makes me feel like I could get out of that situation where, if I explain to you what's going on in my life, you always tell me, what would work better this time, mm-hmm. and then we'll start out slow. And I've never, as a pharmacy technician, again, I've never been seen doctors ever care about their patients because they don't care. They'll use the same drug that any rep will come. I don't know. I just think that.
Yeah.
I was just in a bad spot.
You're right. I mean, there's so many people suffering out there, and that's what kind of drives me that's what drives me with writing my books, doing this show, is I want to get the word out there, and I'm hoping that this show really helps that to happen, because that's my biggest. That's what I want to accomplish with this show is mm-hmm. people understanding mental health and how serious it is, but not only how serious it is, but how treatable it is. I mean, it's so treatable, and I think most people don't know that. And I tell people, look. If you go to a doctor who's not helping you, see someone else. It's amazing to me how people stick with doctors who don't do a good job. If someone doesn't like a store for some reason, they switch this. If someone doesn't like a grocery store, they'll go to a different grocery store. If someone doesn't like a clothing outlet, they'll go to a different one. They'll go to a different whatever. But when it comes to doctors, for some reason, people stick with a doctor that doesn't help them very much and not changing. I think that's. Which is unfortunate, and it's unfortunate that some doctors just don't know.
I feel like they don't get them. I feel like they don't really care about treating what they really need, and especially when people don't want to be on medication. They're scared. They think they're going to be embarrassed or what's wrong with me. And I remember acting like that from the beginning, and you were like, Jessica, I promise you, these is what happens through your brain. Your brain waves mm-hmm. are not. You explained it so well, mm-hmm. and I gave it a shot. And I have never been off my meds because I know that I deeply need it. And unfortunately, it's genetic. Right. And a lot of people have that. Right. And I've been in pharmacy, and I see a lot of people on a lot of the stuff, and mm-hmm. it's not embarrassing. People need to be on it. if they feel a certain way, because these drugs are always different with different people.
Right.
And after we played around with it, we found what I like. We found what needs to be happening on my, like, you check in with me every 3 months. I can call you anytime. Like, you've always been there. And I've had friends tell me that she met with a doctor, psychiatrist, and she doesn't even know what she's giving them.
Right.
She's just, like, not even telling her. And she doesn't feel good. And then she's like, she doesn't explain or add anything. And that's what a couple of my friends told me about their psychiatrist.
They don't explain. They don't explain what they're doing.
Yeah, and why it's important. Like, I remember I was so like, Dr. Gruner, I don't want to take these meds. I'm not depressed. I'm not this, but I have a lot of anxiety. But in general, I really did need it.
Right.
I do. I think I have what is it, bipolar personality disorder.
Yeah.
And it's very hard to deal with that through my stressful life.
Right.
And ever since I've met you and had you as my doctor, I've felt safe. I always feel safe because you know that what I need, honestly. And I encourage people to take them because it's not embarrassing.
Yeah, and as a pharmacy tech too, you're able to talk to people and so you're able to be on the front lines, be able to kind of encourage people.
All different personalities. People see all
right.
looking people, not so whatever it is, unhealthy people, healthy people. They come and take up that medication because they need it. Yep. So everyone's stressed out. The world is not helping a lot, and we can get in our little head. And honestly, seeing a psychiatrist, I would recommend you to anybody.
Well, thank you.
I stuck with you for 12 years, like to day one.
You're stuck with me. I'm not letting you go.
I'm stuck with you, and I'm never leaving.
Well,
and
good.
I love your Hawaiian shirt.
Oh, thanks.
I honestly haven't ever since we talked about when I was feeling like I didn't want to be here anymore.
Yeah.
As I'm getting older, I'm 37 years old. You met me when I had my baby at 28.
Yep.
I brought my little baby in, and now he's 9 years old, and I've been doing a lot better.
Good.
I'm so much calmer, and honestly, took the time to just realize it is what I have, and I just try to
And so what? And so what? And when you say I need things, I remember when people say I need these medications, it's not an addictive need. It's a need of because it's a chemical imbalance, and all we're doing is correcting the imbalances. And for reasons you can't control who your parents are. You can't control your genetics. And
I really feel like your drugs though, because as a pharmacy technician, doctors and psychiatrists, they only prescribe what the reps are giving them for free.
Right.
You'll see that all month on everybody. So I really do think that you're different from everybody because you don't just specifically use what the reps just give you for, how they cater to you, and doctors like that. But you're not like that. You have your own practice. You're super organized. You have great front desk. And you're just there. You're there on the telephone. You're there anytime, and you call me back right away. You guys are so amazing. I frustrate the reps too, because the reps are often upset with me that I'm not prescribing their products. But when I already have products that I've been working with for years, they were generic and cheap, and sometimes the expensive things they come in with, I don't really need to use some of them, and so that can make them unhappy with me at times. But that's not the. My job is not to make the reps happy. My job is to make my patients happy. That's what I like about it. Because I would see 1 month everyone on the same drug. Right. And I'm like, why? And the next month, another one. Yep. So I really feel like you do it out of to truly help me and everybody. That you have a big practice for, your office and being your own person. Yeah. Thank you, Jessica. I appreciate you coming on. I really do. And if you have any problems, you know who to call. All right. And I just want to reach out and just let everybody know, mental health is a serious situation, and asking for help is not a bad thing to do, and giving it a try can change your life. Amen. honestly.
I agree.
And then finding the right psychiatrist that understands you and really could help you throughout anything. Like, seriously, the rest of my life, actually, until you leave.
You're stuck with me.
You don't retire.
I'm not retiring. Don't worry about it. That's I'm at least probably 20, 30 years from that. So.
And you were another doctor prior to that. Like, you have so much knowledge. You told me about how you went to. You go to like all of these like those shows, like those like all those conferences to like learn new stuff. And you write all your books, and everybody that I went and have saw your name on a prescription have told me so how they like you, like how you were so great to them.
Oh, thank you.
So
I appreciate that. All right, enough already.
Thank you for having me here, letting everybody know that it's okay to have medication.
All right. Well, thank you so much for coming on. I really appreciate it.
Thank you, Doctor.
All right.
You have a good day.
Bye.
Bye.
So, anyways, in her case, again, I've known her for a long time, she said. So again, simple things: Pristiq, Wellbutrin, the dynamic duo, serotonin, norepinephrine, dopamine. In her case, we've tried different. She's bipolar, so bipolar patients are kind of up and down. You know, she's not she doesn't get manic, which is bipolar. When she gets what we call bipolar depression, so she really goes through these waves of depression, and you know about it because of her severe history. And also the fact that these antidepressants alone don't completely do the trick. So when I saw her, she had gone off her medications, and she went right back on them. But she used to be on Lamictal. Now, Lamictal is the only antidepressant that works on GABA. Topamax works on GABA, works more for anxiety. Lamictal works on depression. So I put Lamictal on there, which she used to be on, and within a few weeks of being on that, she's really turned around, and now she's doing great. She was going through a really bad time, with her job, pretty much almost homeless, financial ruin. Now she's doing much better, but because but we need to get her mood right in order for her to get her life back on track. So she was suicidal. I made I call suicide pact with her. I was like, no, don't do that. I have to give me time to work on you, please. So I usually try to make a deal with my patients who are suicidal to please give me the time. And I've never had anyone ever go back on that. So it's a good track record. So anyways, with her, it was simple 4 out of 4, serotonin, norepinephrine, dopamine, GABA. She's doing great. I might have to add another mood stabilizer. I'm not sure yet. But since she's doing so well now, I'm just looking to leave her be where she's at. So